Hi, everyone. This is Lucas Voss with Becker's Healthcare. Thanks so much for tuning in to the Becker's Healthcare podcast series and our episode on prescription leakage and the future of health system pharmacy strategy. And I'm so excited to welcome Dr. Patrick Yoder to the podcast. He's the president of Quva BrightStream and chief data analytics officer at Quva. A pharmacist by training, he has spent decades working at the intersection of clinical care informatics and healthcare analytics. Prior to Quva, Dr. Yoder co-founded LogicStream Health and held leadership roles at Walter Scruvo Health, Hennepin County Medical Center, where he focused on using data-driven insights to improve health system performance and patient care. Dr. Yoder, welcome to the podcast. It's so great to have you.
Oh, thanks for having me, Lucas. This is going to be a great session. I'm excited.
Yeah, we have lots to talk about. I do want to start us off with an obvious question and an obvious topic, which is margins for a lot of health systems. There's a lot of increasing pressure around margins to optimize margins while also improving care coordination, which is not easy to do in conjunction. How have you seen the market shift in your experience working in the industry and certainly also being an entrepreneur in the space?
Yeah. I mean, I've been doing this a really long time, so it's been a gradual change, is what I would say. In the early days of my career, 20 years ago, selling to health systems was a very different than today. And I think one of the big differences is that margin pressure is a structural issue now. So it's no longer
Mm.
thought of as a temporary thing that you're going to work through and then recover from, and the margins will go back to where they were before. Now it's really structural. It's about survival.
Mm.
And care coordination has really shifted from a quality initiative to a financial imperative. And that's because care coordination is so closely tied to all of this margin control. So fragmentation from care coordination can increase length of stay, readmissions, ED overuse, and burnout. And what we're really seeing is that provider organizations are very interested in enterprise solutions, and they're no longer looking
Mm.
for point solutions to specific problems. They want vendors and partners that can help them actually solve and tackle these margin issues at scale.
So what you just outlined is also the fact that this is incredibly multidimensional. There's so many factors that are influencing this. And again, within these dynamics, specifically around patient adherence, care continuity, and certainly the financial sustainability that you've just touched on, right? There's so many factors to consider. How are you approaching this challenge? How is Quva BrightStream approaching this challenge?
Yeah, so Quva BrightStream, I mean, we basically have a real-time orchestration engine.
Hmm.
So it basically gathers lots of different data from different areas and combines that all together into a single platform. And then we can apply that to these margin problems, whatever they might be, and actually patient care continuity problems to really drive better outcomes, measurable gains in those outcomes and throughput, and then also margins as well. And we're basically seeing that health systems that invest in this care coordination work at the enterprise level are really making good progress.
Now, we had it in our title that we want to talk a little bit about prescription leakage specifically. Where does that fit into the broader financial and clinical strategy today? And why is it becoming such a focus for health systems right now?
Yeah, so really good question. So finances is not on the health system side is not only just about raw dollars, but it's also about margin. And so as the medications have become more complicated and sophisticated and complex to manage, so think infusions, specialty pharmacy drugs, other drugs that require complex services to make sure patients are safe and treated well. Those things also have big dollar tags associated, big
Mm.
dollars associated with them. We see health systems where that business is approaching $1 billion+
Wow.
in revenue.
Yeah.
In addition to the size, the margin is very high. So if you look at all the other services that they're providing that generate revenue, the margins in these areas are also sometimes the highest
Mm.
across those areas. So it's really a very interesting spot. The other thing that's going on is the care coordination piece of this is also difficult. So access to these drugs can be complicated for these patients. And when it breaks down, the continuity of that care gets disrupted.
Yeah.
And then that leads to emergency room visits and more acute care. And so it's like this vicious cycle that
Yes.
basically fights against the health
Yeah,
system.
it perpetuates itself and then it becomes worse and worse.
Yeah.
We obviously need to fix this. It's a big issue. When we're looking at prescription catcher in and of itself, right? How can we approach that where it supports both better patient outcomes, but then again, also what we've just outlined, which is we need financial stronger performance.
Yeah, I mean, you touched on this earlier, right? It's really a
Mhm.
multifactorial problem, right? So you have clinical care, formulary strategy, supply chain, payer coverage, margin profile of these drugs, and the patients that are actually being prescribed these
Yeah.
drugs. And it's a really complicated thing. And so basically, we need to fully understand the problem. And the health systems really need a broad view combining a whole lot of different data sets to actually understand leakage and how to address it. So that's really pretty critical to all of this. I think in general, the market says, oh, we'll use AI. AI will accelerate this and it'll be great. But the difficulty with AI, two problems in healthcare is large learning models in general today are pretty, let's say, generous with their answers. Let's say that. They basically tend to give you information that's not 100% accurate.
Mhm.
And in healthcare, that's a problem because you're treating patients. And if you actually do the wrong thing, you can injure patients or even kill patients. So it's really important that it's the correct information. And that comes from the data acquisition. So you have to connect all these data sets together. You have to make sure they're combined appropriately. And then you have to make sure they're accessible to these AI agents and LLMs to actually drive the outcomes that you want. So the solutions really need to identify leakage, provide insight into the reasons behind why those patients are leaking. So is it their reimbursement? Is it the location of where they can get an infusion? Is it our formulary doesn't have the agent that they've been prescribed? There are lots of different things. And so ultimately, this visibility and the action against this visibility assures that patients receive the right drugs and they get it quickly and they receive appropriate services alongside it to make sure they're safe.
Is there a common blind spot that you would point towards to where you think, okay, this is the one that health systems most prominently miss in making all of these connections that you've
Yeah.
just described?
Yeah, I really wish that there was like a secret silver bullet here, but health systems are unique. Each one of them is unique, right? The patient mix is different. The providers are different. The supply chain is different.
Mhm.
The reimbursement is different. The formulary is different. You get the idea, right? There's
Yeah.
all these things that are,
Multifaceted.
yeah, that are unique and not only like multifaceted, but they're unique to the health
Yeah.
system and sometimes the clinic that the patient is functioning within. And so basically, you have to work through all these things. So, just a few common blind spots that we see to answer your question more directly: regional or clinic specific gaps, provider preferences or provider workflow preferences. We see that not adherence by the patients, which
Mm.
in and of itself is a whole another problem to talk about. We could probably spend an entire podcast talking
Yes.
about that. Formulary challenges, and then the ever changing reimbursement picture. So
Mhm.
these health systems and the patients are really dealing with formularies that change in their payer. So in thinking their PBM, their pharmacy benefit, that these things change quarterly. So it's really difficult for them as well when they need to change between therapies and maybe they're not comfortable with another one. So there's a lot of complexity here.
Now, again, we've touched on, as you've just mentioned, a lot of the complexity and the blind spots and sort of the things to watch out for, right? What have you seen health systems actually do to translate those data insights that we've touched on then into that meaningful change that we want to see today in healthcare?
Yeah. Yeah, for sure. I think just figuring out where the leakage is happening is not a trivial task. It
Mhm.
sounds like it might be trivial, but it's really, really difficult. And so that the first thing is to show the health system the opportunities in front of them. And then this isn't rocket science, right? It's really kind of going after the biggest things first, right? So if you have like a big medication that's leaking a lot of revenue and a lot of patient care continuity, go there first. So we have one example from a customer that had an over 5 million opportunity in one medication.
Mm.
And really what it boiled down to was a couple of clinics that actually weren't following the standard therapy protocol. Their doctors were doing a different workflow, and this allowed them to fall outside this their kind of standard approach to capture these patients and make sure they were getting good, appropriate continuity of care.
And we talk about standardization quite a bit. And again, that is certainly a great example for it. Again, as health systems continue to look into this, they look at data analytics and certainly strategies connected to them, right? Where do you see the biggest opportunities for leaders to better connect, again, prescribing data, care pathways, and revenue integrity when we're looking certainly at 2026, but also beyond into the future?
Yeah, I mean, I'll circle back to my earlier comment about LLMs, and I think people have this concept that ChatGPT or Claude or Gemini are going to be this like panacea answer to this stuff. And while they are very, very powerful tools, the largest value we're seeing from the application of AI in our work across health systems is really applying it to specific problems.
Hmm.
Right. So think about ChatGPT as this generic tool where you can input anything and it tries to solve that problem, which is really powerful. But when you start to focus that AI into very specific problems and you have models that are either curated along those data sets or specifically built for that, you get much better results, much better applicability. And this isn't new. So if you remember, I mean, I remember, maybe you don't remember, like when the internet came about, everyone thought, oh my gosh, this is going to dramatically change everything, which it
Mhm.
did. It did. A lot of good things, a lot of difficult things, but ultimately, it was the application of that technology in specific areas that did things like make Amazon come to life, right?
Mhm.
So it wasn't just the fact that we had the internet, it's the fact that now a group of people have basically applied it to change how commerce works
Yeah.
and make you, as the consumer, the center of that. And so that will be the same thing that happens with this technology. So things will change a ton and probably for the better. And I think we need to make sure that we control the kind of downsides of this. But there'll be a lot of new changes that come along with that and new challenges. And I think applying those things will be how this stuff actually comes together in real ways because it's so complicated.
Yeah. We'll just have to meet again at the end of the year and talk a little bit more about this complexity and the uniqueness of the space. It's so great to have you, Dr. Yoder. Thanks for being here.
Yeah, I'd love to do that. Appreciate the time in this session.
Yeah, so great to have you. And we also want to thank our podcast sponsor, Quva. You can tune into more podcasts from Becker's Healthcare by visiting our podcast page at beckershospitalreview.com.